for those of you who haven't been here before, I'm Catherine Boughton, and I'm the president of the New York City chapter. Before we begin our programs, we always want to make sure that everybody has access to the accommodations that they need. So you should be able to get our cart captioning just by clicking on the CC. You can move the little box around and get it out of the way if that's what you want. There are different ways to view the screen, either just the speaker or the whole gallery, and you can just do that however it works best for you. It's up in the right-hand corner. We have stream text, which can be seen on a different screen so that you can see it in larger type. And we also have Spanish captions, which are the cart captions translated into Spanish, not by human being, but by AI. So if anyone is not able to get their accommodations, if you could write it in the chat, that would be good. For this presentation also, I'm going to introduce Toni Iacolucci, who is our moderator tonight. I just want to say, in case she doesn't, that it's probably best that everybody put their questions into the chat. If there's any opportunity at the end, we'll have some oral questions, but with this many people, it seems easier to do it in the chat. So we have a really ambitious program tonight, and I want to introduce our speakers. First is Steve Gordon. Steve, maybe you just say hello so people see who you are.
Thank you. Greetings, everyone. Great to see folks.
Okay. So Steve is the Assistant U.S. Attorney. He's widely recognized as the driving force behind the Civil Rights Enforcement Program for the Eastern District of Virginia, pursuing civil rights enforcement cases and engaging extensively in community outreach. He works on approaches to enhancing the ADA compliance. And there was a lot more about him in the announcement. And so if you want to read
got more brownies from different one from Aldi's. I hope they're okay. They have chocolate frosting and stuff. Do you want to me to start dinner?
Whenever.
I'm sorry, who's talking?
Just checking this out.
Got it.
Yes, David, can you please mute everyone?
I am, but I've got more than 100 people to toggle on a small screen. I'm just going slowly.
Oh, okay. I didn't realize you couldn't do that.
Okay. I will explain how to mute yourself and why it's important, because otherwise any movement you make near your computer, your face will show up. It's very, very disruptive. So what you want to do is go to the bottom left-hand corner of your Zoom screen where it says audio, click on it, and a line will go through it. And that shows you that you are now muted. You can do the same thing with video if you want to be on the video, which is often very nice for us to see who's here. Leave it as it is open. If you would like not to be visible, just click on it and a line will go through it and you won't be visible. So I'll continue now with the introduction. So Steve Gordon, Assistant U.S. Attorney, ADA compliance is what I said for people who are tuning in late. Peggy Ellertsen is a past member of the HLAA National Board of Directors, and she is formerly the coordinator for the HLAA Boston chapter. She is trained as a speech language pathologist, and she is a lifetime member of the American Speech Language Hearing Association. And our moderator tonight is Toni Iacolucci, who is on the board of the New York City chapter of the Hearing Loss Association of America. She also is a former national board member, and she currently serves on our board of directors. She has been very instrumental in bringing communication access to healthcare facilities. She is also the co-author of the Guide for Effective Communication in Healthcare, and I'm sure she will put in the chat where you can access that. So Toni, I'm going to mute myself and over to you.
Okay, thank you, Catherine. We are so excited to have this wonderful turnout tonight. We're on 120 people so far. And I think this is an indication not only that this is a topic that is very important for patients with hearing loss, but also for doctors and other providers and for facilities that administer healthcare. We also have a wide range of stakeholders here this evening, researchers, administrators, policy folks, and lots of patients. So thank you all for joining us. Peggy's going to talk tonight about barriers to access in healthcare, and she's going to give us her thoughts about how we can scale some of those barriers. Steve will talk to us about the ADA, what rights we are guaranteed, and how to get what we need and what to do if we don't get them. I want to talk just a little bit about HLAA's Communication Access in Healthcare program. It was created in 2020 in response to the fact that HLA was getting many calls and emails about the difficulty people were having hearing their providers, which of course is a dangerous situation. The program's purpose is to collaborate with a wide variety of health stakeholders who are invested in healthcare to work towards communication access for all patients in all facilities in all of their encounters. Since the inception of the program, there is a strategic committee that consists of 4 members. Elaine McCaffrey in Chicago, Meg Walhagen, who's at University of California, San Francisco, Peggy's up in Boston, and I am in New York City. We also have 3 advisors, Megan Morris, Nick Reed, who many of you probably know. They are doing some very important work in healthcare access. And I'm pleased to say that they are both now at NYU Langone Medical Center. So they are here in New York City with me, and David is cheering back there. Our 3rd advisor is Neil Snyder. He is HLAA's Director of Public Policy, and we are thrilled to have his support. All 4 of us are former HLA National Board members. Elaine still sits on that board, and Peggy, Elaine, and I have profound hearing loss. So we have lived everything that you're going to hear today. When we began to strategize about how we would reach our mission in this program, we've sort of gone through 3 phases. The first phase was, well, the ADA said it's up to the patient to self-disclose their hearing loss and to ask for what they need. So we went gung-ho, reaching out to chapters, everyone we could think of, to get people to self-advocate. But then as we began to talk with other stakeholders and did some work in hospitals, we realized that the access really needed to be generated there, because not only is it the best way for everyone to get access, but it's in the best interest of the patient, the provider, and the facility. Saves time, saves money, makes for safer and better care for the patient. So that is why we are here to move all of this forward today. Have a couple of quick announcements. Since I'm anticipating a lot of questions, please type your questions in the chat. And make them as concise as possible. We would also welcome suggestions as to how to move the needle forward on this. If we have time for live questions, for those of you who may need our interpreter to voice for you, just, put it in the chat and we will do that, or the interpreter will voice. We'll work it out and see how it goes. HLA, as of today, the national office has launched a new website. You can access that at hearingloss.org. You go to the top of the website and see advocacy and resources, and then you will get a drop down and you can click the Communication Access in Healthcare program. Lots of resources, articles by a lot of stakeholders, some of whom are on this call. There's even a call to action on there about telehealth and captions. And I just want to give a couple of other email addresses. I'm seeing all kinds of things popping up on the chat already. There will be a recording posted on hearinglossnyc.org. Tonight's recording will be there in a week or so. There's a new thing. I gave you hearingloss.org, and there was one more that I wanted to give you, which is escaping me at the moment. So I will come back with that later on. So one more thing before I hand this over to Peggy. I have the great pleasure of meeting with Peggy at least once a week as we work on this program. And a couple of weeks ago, when we were talking about this presentation, she said something that really resonated with me. So I am going to read what she said right here. And the quote is, "As patients with hearing loss, we still need to do the heavy lifting. But if we keep our focus on doing the right things to make our own healthcare accessible every time, it will eventually transition to systemic change," end quote. So we really believe that. We hope this meeting will make the heavy lifting a little bit easier for patients, and we hope that every stakeholder on this call will help to bring attention and awareness to the fact that healthcare access is an absolute necessity, and whatever relationship we have to healthcare, we need to all step up and make this need known. So thanks a million for being here tonight. Peggy, turning it over to you. Thanks.
Okay, great. It is just so great to be here, and I'm seeing lots of familiar faces. Well, people that I don't see very often. So hi, Sandy Pearson and Brenda Batat, and a bunch of other folks that are on this call. We're very excited about sharing with you some of the work that we've been doing and some of our insights. And I want to say from the outset that I'm going to be talking about just 3 of the barriers that exist in the healthcare systems by and large. And I'm not going to be talking about those in an effort to absolve the healthcare system from providing access, but rather to demystify for all of us why it's so often hard to gain communication access, aids, and services. We hope that this session will deepen your understanding of those barriers and that we're able to stimulate your thinking about the steps that we as patients can and must take to improve communication access in healthcare. Our goal is to support the hearing loss community in an ever more skillful, determined effort to make the robust legal protections that are already in place work for us so that we have a positive impact on our experiences as patients. So I'm going to start by sharing with you a personal story. This is something that happened to me in 2016. So it's 4 years before I began to work with Toni, Meg, Elaine, and our wonderful research advisors and other stakeholders. The problems with communication access started to become very real for me in 2016 on Christmas Eve night, when I was walking down a hill toward a church with my family where we were going to services, and I slipped on a patch of black ice and I incurred a very serious fracture of my left humerus. Unfortunately, I'm left-handed. That's a whole other problem. But I began to work with a very good orthopedist and with a wonderful physical therapist. I had a very intensive regimen of physical therapy. And about 7 weeks after my accident, I became very worried that I was going to re-injure myself. I actually had a friend who told me that that can sometimes happen. So I called the orthopedist. He called me right back. And I just wanted to sort of walk through it with him. I soon enough realized that on the phone, he had a very fast rate of speech. And we tried for a few moments to slow it down. He was on a tight schedule. And so he said, "Please give your phone to your husband and he can act as a communication intermediary." So I agreed to this because it was time expedient and what could possibly go wrong. Yeah, I did not get I did not get my questions sufficiently answered. And I think more important, when I got back on the phone and requested that we do this using the patient portal or even email, my physician said, I don't use them. And he would not negotiate that with me. So I had a lot of immediate strong feelings. I was confused. He had been a wonderful physician up to that point, but on this very important issue, he dropped the ball. And I also felt a very profound loss of agency in taking care of myself. So I sort of calmed myself down. And then the next day I called his office, made an in-office appointment, which fortunately I was able to get right away. And later that week I went in, and for about 15 minutes we talked. And I basically tried to share with him what it's like to have a hearing loss. I always think of Sherry Ebert's metaphor of Wheel of Fortune, where you're trying to fill in missing parts. So, he shook his head a lot. He asked a lot of questions. I told him what I absolutely was going to need moving forward. He seemed curious. And so when I left his office, I had the sense that he had learned something that was brand new. Now it's 8 years later, and through the work that we've been doing and that we continue to do, we've become much more aware of the fact that there are barriers within the healthcare system that impact not just patients, but also the providers who are caring for patients. So I'm going to walk us through 3 of those barriers. Again, not to absolve healthcare systems, but to help to demystify the problem so that we can begin to self-advocate maybe a little bit smarter. This has helped me enormously in my self-advocacy, and we're hoping that it will help you. First, I want to tell you just a little bit about our work. Our affiliation with HLAA has made it possible for our team to have conversations with a pretty amazing range of stakeholders. We've had lots of conversations with public health researchers, ADA coordinators, patient advocates, equity officers, leaders in nurse education, leaders in the field of nursing, medical students, and nursing students. It's been quite remarkable. And our work with stakeholders has given us greater insight about the fact that breaking down, or at least working around these barriers, is going to require all of us to, among other things, be skillful, persistent, long-term participants in self-advocacy. And so we're hoping that moving forward, we can give you more and more tools to help you do that. So the barriers. The first one is the one that I think is huge. There's an absence of foundational integrated training in the education of medical and nursing students in the care of patients with disabilities. There's also a weak level of knowledge about the responsibilities of medical providers mandated by the ADA. And I'll give you just an example. There was one study in 2022 done by public health researchers here in Boston. It was a survey conducted with a large number of physicians. In the respondents, a third of over 700 physicians reported having little or no training on the law and its implications for their practices, and 68% felt that they were at risk for ADA lawsuits. So it's likely that when you are receiving health care, you're working with a provider or a team of providers who may be excellent physicians, but who have been given little or no training in understanding the impact of your hearing loss or your communication needs. A second barrier, lack of basic awareness about the experience of hearing loss and the potential implications of hearing loss in a patient's health outcome. Now, this is an issue that Toni, Elaine, Meg, and I have talked about a lot. Whenever we meet, we talk about it. We think that lack of awareness that exists in medical systems is not terribly different from the lack of awareness that takes place in other non-medical situations in which our communication partners don't know what it is. That is, that they know we have a hearing loss. They don't know what the experience of hearing loss is, and they don't know what to do. Awareness, we think, requires a certain kind of knowing. So probably in your constellation of communication partners, there are some people who sort of get it and sort of know what to do, and others who just don't. And we think that this is perhaps a form of intuition, or maybe even empathy. I even came up with empathic intuition. But we think that this is something that is widespread in the area of what our medical providers bring to the appointment. Also, interestingly, there are anecdotes that have been shared by our contacts in public health, which they talk about their hospital systems in which progress has been made. Very often, there's a person in the upper levels of administration who has a disability or who has a family member with a disability. And so we can conclude that in those cases, the person may well have a deeper awareness of the lived experience. And I just want to add here that I think, looking back on my experience with my orthopedist, it's not that he didn't know I had a hearing loss. I had told him he had a hearing loss, but rather he didn't quite get what that experience was and how crucial it was that he listened to my suggestions about the things that I needed to make it better, including the fact that he was also in a time crunch. So a third competing need, and this is one that particularly happens in hospital settings, and it has to do with the time crunch. And it also has to do with the fact that in the functioning of hospitals, there's a very strong focus placed on the prevention of medical errors that result in significant problems with patient safety or quality of care. Such medical errors are referred to as never events, and they include things like patient falls or infections that are caused by certain procedures. There's a whole official list of them with strong research data that demonstrates practices that prevent never events from happening. Importantly, when a never event does occur, hospitals are denied reimbursement. And so there is a very strong need to prevent them, and specific practices that have been demonstrated in the research to prevent these problems are prioritized in the ways that hospitals function. Now, despite the fact that there is a strong correlation, it's been demonstrated in the research, a strong correlation between hearing loss and less good health outcomes, there's not a lot of research that demonstrates that lack of aids and services is the cause of poor healthcare outcomes in patients with hearing loss. Another way of saying this is that there isn't strong research data to show that specific aids and services improve the health outcomes of people with hearing loss. So it's most unfortunate, but because of this, failure to provide appropriate aids and services for patients with hearing loss does not typically rise to the level of never events. And so there is slow progress in the direction of compliance with the ADA in many medical systems. There is reason for optimism. In spite of this policy, there are hospital settings that have built exemplary systems that provide communication aids and services in our healthcare. And in our program's work, for the 4 of us who are working on this, we do a lot of work with the group, the Disability Equity Collaborative, in which researchers, again, this wide range of pretty amazing stakeholders, meet regularly to contribute to the work of building tools for healthcare systems so that they can begin to create a smoother path to implementation. As we learn from professionals who are working toward increasing compliance with the law in healthcare, what is clear is that people with disabilities must continue to learn to be knowledgeable self-advocates. So one of the things that Toni and I are going to start to tackle is the development of a flow chart of tools that we think may offer patients with hearing loss step-by-step guidance for their self-advocacy efforts all along the spectrum of experiences that are involved in receiving health care. In the meantime, I want to add that this is a marathon. Improving the system will require resilience, persistence, and commitment to a long-term process of advocacy that we invite all of you to consider taking on for the long term, because we can only begin to change the system if we work on this together. So now I'm going to turn the mic over to Steve, who's going to share some really great news about the legal protections designed around safe and effective communication in our healthcare.
Thank you very much, Peggy. And I'm going to put up a PowerPoint that I'm going to share. And one of the things I want to do is I want to invite everyone to figure out for yourself what's the best way to follow all of this. It might be following the captions. And you don't need to follow the PowerPoint so much. The PowerPoint's a little bit for my own need because it helps me to figure out how to stay organized and what to say. So first of all, I'm going to talk a little bit about what this presentation is. It provides an introduction to the ADA's effective communication provisions. If you work for a healthcare provider, because I know we have a lot of different kinds of stakeholders on the call today, you should seek out additional ADA training, and you should include your frontline staff in such training. At the end of this presentation, there is a link to another training that I did, and there's also a link to other organizations that provide training. And as Peggy explained, one of the big issues is that in healthcare trainings, whether it's doctors, nurses, social workers, the ADA is not typically part of what is taught. So it's really important. And ADA is not a one and done type thing. It's really something that folks need to get multiple trainings because there's a lot of different parts to the Americans with Disabilities Act. So this is very much an appetizer presentation. In terms of the time that's available, a presentation on the ADA's effective communications provisions, complete presentation will probably take at least a full day, if not longer. So think of this as a little bit of an introduction to the topic. A tool, and Peggy was talking about a toolkit that HLAA is putting together. And my office issued a Dear Colleague letter, which we circulated to healthcare providers here in Virginia. And by the way, I know we have some stakeholders from Virginia, and I'm pleased that you're here. And the Dear Colleague letter provided detailed reminders of what healthcare providers are required to do for people with a variety of communication disabilities, including people who are hard of hearing. And you can see in this slide that the Dear Colleague letters up at the top are in a different color and underlined. And when you get the presentation, and I know the presentation is going to be circulated, if you click on one of those areas that's underlined, it'll take you directly to hyperlink. It'll take you directly to the document that it's referencing. And this is a pretty detailed letter that explains what the ADA requires. And a lot of people here in Virginia, what they do is they take the letter, and if they're having difficulty with the healthcare provider providing them with the services, they will email them and say, hey, look, the Department of Justice issued this Dear Colleague letter. There's a lot of resources in here to help you understand what you're supposed to do. So it could be part of your toolkit as you're trying to do self-advocacy. So during my presentation, I'm going to do a little bit of background on the ADA. I'm going to talk a bit about what's required to ensure effective communication for individuals who are hard of hearing. I'm going to explain that lacking knowledge, having ignorance of the ADAs and the Rehabilitation Act, which is very similar to the ADA, that if a healthcare provider doesn't know what it's supposed to do, that's not a valid defense. So if someone says to you, well, I really don't know what I'm supposed to do, so I can't be, held liable for this, that's not how the ADA works. I'm also going to provide for some tools for effective advocacy for people who are hard of hearing. So a really important resource that I highly recommend looking at is ada.gov. And there's something called technical assistance, and there's a bunch of technical assistance publications on ada.gov. Something else that you'll find really useful is our settlement agreements. And you can find that on ada.gov as well as the Civil Rights Division's disability section. And these settlement agreements provide roadmaps for what different types of healthcare providers are supposed to be doing. So if I have a settlement agreement with a hospital or a nursing facility, it'll provide the things that they're supposed to be doing to get themselves into compliance with the ADA. And it can be very useful, another tool that you can use. So if you're dealing with a nursing facility, it says, well, we don't have to provide auxiliary aids and services to people who are hard of hearing. You can point out, well, the Department of Justice has reached settlement agreements with nursing facilities. It also provides the regulations and the statutes and briefs and other things too. So let's talk a little bit about what's covered by the ADA. I'm not going to really discuss employment. It is covered. It's a very important topic, but that's beyond the scope of what we're going to talk about today. I am going to discuss state and local government services because a lot of state and local governments offer healthcare services. And that could include adult daycare for people who have memory issues. It can include mental health services. We also here in Virginia, some of our universities provide hospitals like the University of Virginia, and it's the same in other states. I'm also going to talk about public accommodations. Now, public accommodations is a term of art used in the civil rights area, and what it really means is private companies. A lot of hospitals in this country are owned by private companies. And they're covered by the ADA under Title III. Telecommunications is also covered by the ADA, and that includes things like providing the relay service and also captioning for telephones. So when I said that Title II covers public entities, I want to be very clear. It covers all public entities. And there are a few examples listed on this slide, such as the state's Medicaid program. Very important. If you're dealing with the Medicaid program in your state, that's covered by the ADA, and they need to ensure that they're complying with the ADA. Hospitals operated by state or local governments, and that includes psychiatric hospitals. and state universities. Those are all covered by the ADA. State and local mental health agencies. Emergency medical services. This is when the first responders come out. That's covered. There's other healthcare providers, such as infirmaries at a state university or at a jail or prison. Those are all covered by Title II as well. And again, this is not meant to be an exhaustive list. It's just a few examples. Title III covers, and I said private entities, so that's private hospitals, private nursing homes, and then any kind of professional office of a healthcare provider that you can think of. And that includes urgent care centers. It includes things like the Minute Clinic at CVS. Very important. One of my colleagues in the U.S. Attorney's Office in Rhode Island reached a settlement agreement with the Minute Clinics because they weren't providing auxiliary aids and services. It includes things like internists, dentists, optometrists are covered. We have a settlement agreement here in Virginia with an optometry practice. It had to do with failing to be physically accessible, but these are all covered by the ADA. Mental health professionals, very important, covered by the ADA. And all other kinds of healthcare specialists that you can think of. The other thing that's covered is pharmacies. Okay, so very important, especially during COVID, when people are going to get vaccines. And sometimes in the past, pharmacies provided tests as well. These are covered because they're healthcare providers. Pretty much any kind of healthcare provider that you can think of is going to be covered by the ADA. So I'm going to talk a little bit about examples of prohibited practices under the ADA. Really important prohibited practice in this area is the failure to provide auxiliary aids or services. And this is kind of a fancy term of art for things like CART or assisted listening devices. And healthcare providers have an affirmative obligation to provide auxiliary aids and services to ensure effective communication. What would that look like? Again, with CART, if you go to a healthcare provider and you need a transcription, they are legally under the ADA required to provide that for you. Same thing if someone is deaf and they use ASL, they're required to provide the sign language interpreter. A second important prohibited practice is imposing eligibility criteria that screen out or tend to screen out individuals with disabilities. What would this look like? If, for example, someone doesn't have CART and they say, well, I'm not willing to get CART, you can't come to this medical practice, or you can't use this nursing facility or hospital because we don't have CART and we're not willing to get it, so please don't come here anymore. That violates the eligibility criteria discrimination provisions of the Americans with Disabilities Act. So again, if someone tells you, we're not going to provide services because we don't have the auxiliary aids and services that you need, that is likely going to violate the ADA. Next thing is prohibited is charging you a surcharge, charging extra for the cost of compliance with the ADA. So if a healthcare practice is required to provide CART or another type of auxiliary aid or service or a type of phone that works for you, and they say, okay, well, now we're going to put it on your bill, that violates the ADA. That's part of their overhead, and they're not supposed to pass that charge along to you. So an important concept to understand is that effective communication is recognized by the ADA as a fundamental human right. And it's not enough that you have a good healthcare outcome. Obviously, that's important, but that's not a defense. I've had people come and say to me, well, we didn't provide the auxiliary aid or service, but the health outcome was just fine. Well, the issue here is that communication is a fundamental human right, and that needs to be provided, okay? And that's really an important part of how the ADA operates and what Congress was trying to do. Another important concept is that communication in healthcare settings is often very high stakes. Literally, it's life and death in many situations. So it's really important that healthcare providers ensure that they have effective communication with all of their patients and also the companions of their patients. And I'll talk more about that in a moment. But because of what's at stake, this is an area where effective communication is particularly important. Now, the type of auxiliary aid or service that's needed to provide effective communication is going to vary by the patient or the companion, and it depends on many factors. The most important factor needed to be considered is what is the method of communication of that particular individual, all right? So it's really important that providers consult with an individual, and private providers are legally required to consult and ask what is going to help. If it is a public entity, a state or local governmental entity, they have to give primary consideration to the request of the individual with a communication disability. If it is a public accommodation, this is a private entity, they need to consult and make sure whatever they provide is actually effective for that particular individual. So the ADA requires that the auxiliary aid or service provided meets the communication needs of the individual. And this means that if they say, well, here's what we usually provide to people with hearing disabilities, and it's VRI or a sign language interpreter, but you don't know sign language, that's not going to be effective. And that's going to violate the ADA. So they need to figure out what's going to work for that individual.
Huh.
Right? And as I said, they're required to consult if it's a private entity, and the auxiliary aid or service used must be effective. And if it's a public entity, they're required to give primary consideration to the request of the individual with the disability. So there's a lot of different types of auxiliary aids or services, and different people have different needs. I talked about CART, which is computer-assisted real-time captioning. There's also captioned phones. There's assisted listening systems and devices, telephone relay, hearing aid compatible phones, video phones, sign language interpreting. I know there's also people out there who have a T-coil in their hearing aid, and that allows for someone to speak into a microphone and they'll be able to hear it. So it's really important just to understand there's a variety of auxiliary aids or services that are out there. Another factor to consider when considering what auxiliary aid or service would be useful is the nature of the communication. So if you're going to the gift shop in a hospital to buy a teddy bear, it's likely that handwritten notes may be enough. You're not going to need CART. But as soon as you have more complex communication, such as discussing a medical condition or medical history, that's likely going to require more complex auxiliary aids or services, including CART. So very important. Healthcare providers must ensure effective communication with all of its programs. This includes not just the medical appointments, but also educational classes provided by hospitals. So hospitals sometimes provide classes on CPR or on birthing or weight loss or a lot of other different issues nowadays, diabetes. All of these courses need to have auxiliary aids or services for the people with communication disabilities. So it's very important to understand the range of activities that healthcare providers offer and how they're all covered by the ADA. Telehealth. Okay, we all became very familiar with telehealth, I'm guessing, during the pandemic. And this can take a lot of different formats. It can be a video call, it could be a telephone call, and telehealth appointments are covered by the ADA as well. So auxiliary aids and services must be provided for telehealth. And here's another tool for your toolkit. The United States Department of Justice, along with the United States Department of Health and Human Services, issued guidance on non-discrimination in telehealth. And again, there's a hyperlink at the top of this slide, which will take you right to that guidance. And it's very helpful because it goes over the fact that healthcare providers using telehealth need to ensure that those telehealth platforms are able to have auxiliary aids and services as well. So companions have the same right to auxiliary aids and services that'll ensure effective communication as the patient. This means if someone comes in with their brother or their spouse or a parent, and that person has a communication disability, it's very important. Healthcare providers need to provide auxiliary aids, not just for the patient, but also for companions. And under the ADA, companions is very broadly defined. Okay, it's not simply someone who's a healthcare proxy, right? It can be a family member, it can be a friend, it can be a distant relative, it could be a neighbor. It's very broadly defined. So anyone who's facing that issue, if you yourself aren't the patient, but you have the communication disability and you go with someone to a healthcare provider, you might, under those circumstances, be entitled to auxiliary aids and services as well. On the other hand, there's another area where the word companion comes up, and that is the ADA prohibits reliance on adult companions to facilitate communication. So what Peggy was talking about, where they were trying to go, I think she said to her husband, to facilitate communication, that violates the ADA, okay? Just because someone has someone with them doesn't mean that that healthcare provider can enlist them to suddenly become a communication facilitator. Now, if it's a child, it's very important to know, because healthcare providers have done this as well, that there's only one exception with children, and that is if there's a tornado or an emergency bearing down and you want to ask the child to help communicate, let's say to their parent, to go down to the basement. If it's an adult, there is another set of exceptions in addition to the emergency situation, and that is when there's consent of the person with the disability, there's consent of the person who's going to be facilitating communication, and it's appropriate under the circumstances. If all three of those are not present, using a companion is not appropriate. And consent doesn't mean, oh, we forgot to get the cart person this time, so we now need to enlist someone. That's not consent, okay? Very important to understand. That's duress that the person is under those circumstances. So it must be voluntary. Something else that comes up in our cases is a covered entity's subjective belief that it's complying with the ADA when in fact it's not in compliance. This is not a valid defense. The mistaken belief by a healthcare provider that they're doing something that they think is what they're supposed to be doing and it's not correct, that's not a valid defense. I see that all too often because entities aren't properly educated about what they're supposed to do. So let me give you some practical tips based on the things that I've seen in my cases. One of the most important things is to create a paper trail, including a written request for the auxiliary aid or service that you need. A lot of times when I start diving into these cases, it'll turn into a he said, she said situation where the healthcare provider says, well, they never asked me for that. And the person said, I did ask. Well, the really good way to resolve that type of situation is to ask in writing. Get an email address, write a letter. I know it's a little bit old-fashioned from 20th century, but if you can't get an email address, you can write a letter and explain exactly what you need, when you need it, when the appointment is going to be, and put it in writing. And often that will get you a better result because the healthcare provider will go and consult with other people to figure out what they're legally required to do. So again, a really important takeaway from today is when you need auxiliary aids or services, an important part of your toolkit is your email, your pen, putting it in writing. Now, if you're running into barriers, the receptionist or the nurse at the nursing station doesn't understand, reach out to a patient advocate or an ombudsman if it's a big facility. And some facilities might even have an ADA coordinator, and they might have it as part of their civil rights program, their civil rights coordinator. There's many different names for this. If it's a public entity, meaning that they're run by a state or local government, they are legally required to have an ADA coordinator. But you might have to look around. Don't assume that just because you talk to the receptionist or the supervisor on duty, that that's the end of your inquiry. You might have to bring it up to the next level. Now, it shouldn't be required that you do that, but as a practical matter, it might help you to get the result you want. Now, if you're still running into issues, you can elevate it to someone like the director of nursing at a skilled nursing facility or the administrator and bring it to their attention. This is the type of thing that sometimes needs to be elevated within an organization to get the results. I'll tell you, a lot of entities now have a lot of turnover, and they're not training everyone the way they should. So you may need to go to a high-level person, and their websites often will tell you who the leadership is. Then one option that's always available, and that's available at any time, is to file a complaint with the Department of Justice. If you're here in where I am in the Eastern District of Virginia, you can reach out to me. There's also a complaint portal on the Department of Justice webpage. And they are seeking out complaints where an issue comes up. There's other places to file a complaint, like the Department of Health and Human Services as an Office of Civil Rights, and that's another possibility. It's important to know that those are two places to go where we enforce civil rights statutes. So I want to give you a couple of other tools that people have sent around when they're asking for auxiliary aids and services. One is called ADA Business Brief, Communication with People Who Are Deaf or Hard of Hearing in Hospital Settings. And there's a hyperlink on my PowerPoint. And I know that people have sent this not only to hospitals, but also skilled nursing facilities and other types of facilities as well. Another publication, ADA Requirements, Effective Communication, is very helpful as well. A lot of the things that I've discussed today are put into plain language, easy to understand. And again, you can use this as an advocacy tool. When you send that paper record that you're creating, you can attach or provide a link to these publications and then quote them, what you're asking for. And there's often support in there. And I also mentioned the Dear Colleague letter at the top of the presentation. And it's another tool or resource that you can use. So one other thing I want to explain is that I gave a webinar. I covered a bit more material back in August, and that webinar is now posted on the Southeast ADA Center's webinar site, and it was co-sponsored with the Mid-Atlantic ADA Center. And again, where the word webinar is on this slide, that is a hyperlink. So if you want to take a look at that, there's a long form of the presentation, which has a lot of legal sites in there as well. And it's a helpful resource if you want to see this discussed. It also discusses other communication disabilities in addition to being hard of hearing. So it's useful if you want to learn about other disabilities and what's required. And then finally, this is my contact information. And I welcome emails, phone calls. Emails tend to be a little bit better because I'm often working on things. And feel free to reach out to me, take a photograph or a screenshot of this right now. This will be attached to the PowerPoint slides that Toni and Peggy send around later. And speaking of Toni and Peggy, I just want to express my enormous gratitude to both Toni and Peggy, who gave me a lot of assistance in coming up with this presentation. I was not feeling well for the last few weeks, and they were very helpful in providing me with assistance as I was crafting the presentation that I just gave. And Toni did us the great honor of being part of a community meeting that we did back in 2023. And it was wonderful having her talk about her lived experience in this space. So for the folks here on the call, you have a lot of really wonderful resources here that can be very helpful to you in understanding these issues. I'm going to stop sharing my contact information, but I could also put it up into the chat for folks. Let's see if I can stop the share so that we all can kind of go back into the other mode. There we go. And Toni, you're muted. There you go.
Okay, Steve, thank you. Peggy, thank you. So much information, really terrific. The chat is buzzing, so I'm doing my best to keep up with it. First, David just posted some links that Steve has covered or talked about that would be really helpful to you. So they are in the chat right now. I'm going to go back and give you some email addresses again. I'm sorry I don't have this on a slide. They're very similar. The first one is hearinglossnyc.org. That is the New York City chapter who is sponsoring this evening. And they will, that is where Steve's recording will be, the recording for this entire meeting will be posted there. We're also going to post Steve's more detailed slide deck. It was very important to Steve that not just patients have what they need to learn how to access or to provide communication access, but also all the other stakeholders, whether they be hospital administrators, attorneys, whoever. So there will be a full slide deck. Someone was asking in the chat how would they access some of the links that Steve put up here. So when you see his slide deck on the New York City chapter, you will be able to access that. Again, the second email, the second web address is hearingloss.org. That is the national office of HLAA. And as I mentioned, they have launched their new website today. If you go to that website and you click advocacy and resources on the top, and then the drop down will take you to the communication access and healthcare program on that webpage. And I'm going to give you the email address right now is how you can reach the strategic committee. So anything that got missed tonight, any information you need or something you can't find, shoot us an email. And that address is healthcareaccess1@gmail.com. Again, healthcareaccess1@gmail.com. So we have tons of great questions. I just want to say many of the things that people put in the chat I wish everyone had time to go through and see those comments because they are about how difficult it is to be in a medical situation and not be able to understand. Lots of situations were expressed. Suggestions were made mostly about specific aids and services that asking whether they're available or if they could be made available, how the situation could be made better. I'm going to try right now to answer mostly the more general questions or the questions that pertain to ADA and stuff while we have Steve here. And then we will try and get to some of the other things. But please, I'm sorry, there are so many things up here. If I miss someone's question and you have something important, feel free to contact us at the Healthcare Access website. We'll do our best to answer. We are looking for positive suggestions, not just about particular aids or services that might be helpful, but just in general, how can we be better at getting this issue out there? 20 years ago, before HLAA was getting the word out, I mean, they've been doing that for years, but before they had more opportunities through websites and social media, nobody knew about hearing loss. Nobody wrote about hearing loss. And now that has changed tremendously. So we need to do that with this issue as well. Okay. So now I'm going to try and breeze through a couple of questions. One was, this is for you, Steve. Are the ADA requirements applicable to all mental health providers or only those that receive some variation of federal funding, including Medicare?
Excellent question. So the ADA was passed in 1990 to extend what was covered by the Rehabilitation Act of 1973. And the Rehabilitation Act only applies to recipients of federal funding. The ADA applies to all healthcare providers, not just those that receive federal funding. And that was one of the reasons that it was passed, was to cover all healthcare providers.
Okay. This was another question by the same person. And Steve, I couldn't listen to you because I was monitoring the chat. So the question is the concept of, I'm not sure exactly what this question means. Hopefully you'll understand. Is the concept of undue burden that's related to providing effective access, is this no longer a valid issue?
So it is still part of the ADA. One of the things, though, that a lot of people don't recognize is that it doesn't immunize someone from providing auxiliary aids or services. It might mean that they don't provide the most expensive one, but they have to provide something. It's not an all or nothing proposition. If it's an undue burden, it may well be that there's other things that they need to do.
Okay. This is from Catherine. How can first responders be compliant with the ADA, as there can be no prior preparations with the patient in that situation? And do you know if text 911 has been adapted throughout the country?
I don't know if text 911 has been adopted throughout the country. I know a while back, the National Association of the Deaf was actually working on that issue. And I think they might even have some white papers on it on their website. EMS is a tricky question. And here in Virginia, I know that there was an effort to get EMS more aware of some of the things that they needed to do to ensure that first responders had some access to auxiliary aids and services as well. And a part of this is the training. It's what Peggy was talking about earlier. When someone goes through that EMS training, helping them to understand that if they come across someone who's hard of hearing and providing them with the tools, let's say in the ambulance, so that they have something that might be able to help them provide CART. A lot of that is possible emergency rooms at hospitals aren't going to know ahead of time when someone might have hearing loss or another disability, yet they're still required to be ready for such things. And it's true of EMS as well.
Okay, Peggy, I don't know if you can maybe give us a response on this one. The question is, how can the EMR, the electronic health records, be enhanced to put hearing loss as first diagnosis or put along with the place for allergies to be practiced so that it is seen all the time? Okay, can you respond to that? Thanks.
You're muted, Peggy.
Peggy. Oh, Peggy, you're muted. We can't hear you. We can't hear you.
Peggy's not muted. She's must be some other audio issue, but she is listed as not muted.
Okay, Peggy, there's something wrong. We can't hear you at the moment. So let me just try and give a quick response to that. It's funny, I have a niece who had access to medical records in the compliance work that she did, and she showed me one once. And the question about, do you have any challenges with communication, was number 16. Okay, so that exactly goes to your question. It should be number 1. If you can't communicate, you can't get any farther in your healthcare or in your treatment. There's been lots of research done by Megan Morris and many others and work done with the Disability Equity Collaborative that Peggy mentioned to try and work with the big healthcare companies to enhance the records. Peggy and I have also been meeting, writing, communicating with a couple of the large tech companies that develop the software, so we can talk to them about more best practices. I know, Peggy, are you on yet? Can we hear you? No, sorry. Okay, what a shame. All right, we'll move on. Someone asked, Steve, this is you. Can you be denied auxiliary aids and services due to HIPAA?
I'm not familiar with any HIPAA rule that would deny it. I'm imagining that healthcare providers might attempt to use that as an excuse for not providing it, but I'm not aware of any HIPAA rule that prevents the provision of auxiliary aids and services.
Can I interrupt? So as somebody on the healthcare side, something we're always a little bit uncomfortable about, at least I am always uncomfortable about, is a lot of the tools that do auto captioning, for an example, send the audio out to an external server and are not HIPAA compliant. And I always have this issue of, I have a tool that I know would be helpful to someone, but I also know is not HIPAA compliant, and I'm never quite sure what the best way to handle that is.
I don't know, Steve, if you have an answer to that. I can maybe comment.
Yeah, I don't know that I have an answer to that. I know that when COVID first started, some of the video tools that were out there entered into different kinds of agreements with healthcare providers to make it HIPAA compliant. So that is, one possibility, and it's just a practical thing. But I'm just not familiar with all the different tools that are out there.
Yeah, I think that this is an issue that there's going to continue to be some work and discussion on. Speech to text apps are a lifesaver for many of us, and some providers are perfectly fine using them, and some get very uptight. I don't know if this law this issue has or will be challenged for those that refuse to use it. I know many hospitals have their own intranet system so that there are no issues with recordings going out. And this is one of the examples where I think that the hospital should be taking on more responsibility. They should be, if they use their own devices, then they can make sure that they're secure instead of expecting us to bring our devices, and they should just be providing it. There are ways that these things can be worked out, and that's why we need to be the loudest voice, not just the patient voice, but all of you out there who are researchers, administrators. We all need to speak up and to work out these issues, and your best source for getting people to guide you in what our best practices are those of us with hearing loss, and Hearing Loss Association of America is just a great source for those people. So we hope that the other stakeholders will reach out to us. To go on, there are, I'm sorry, there's so many here. Several people are asking, do the ADA stipulations that you're talking about, do they also apply to nursing homes, assisted living facilities, things like that in terms of providing aids and services?
Nursing homes, absolutely. I have several settlement agreements, including one with something called CMC3, which operates 48 nursing facilities, and assisted living facilities to the extent that they provide social services within the assisted living facility. They're going to be covered by the ADA. They may also be covered by the Fair Housing Act, which protects people with disabilities as well. And it's a different set of rules, but some of them are similar.
Okay, here's another one for you, Steve. How do we know if a facility falls under Title II or Title III, and whether they get government funded?
So this is something that I often think about when I first get a new case, and I go and I look at the website frequently, and I see, okay, is it part of a state or local government of some sort? And if it is, then it's Title II. And if it's not, it's Title III. And I know there are some things that are a little bit in the middle between those. If they get federal funding, it just means that the Rehab Act applies in addition to the ADA. It doesn't change between Title II and Title III, though.
Okay. What to do? Oh, Peggy, we can't get you in here. Okay, well, Steve, maybe you can do this. Well, I guess this is a Steve question. What if you write a request for an aid or service, and the entity denies that they ever received it, and you've sent repeated emails or whatever, filled out forms online, and you're just not getting it?
Well, that might be time to file a complaint with all your documents with the Department of Justice or the Department of Health and Human Services Office of Civil Rights. And you have that paper record showing what you've sent.
Okay. I have a question for you, Steve. So you can file with the Department of Justice, Health and Human Services. How do you know what's the best place to file a complaint with? There's also the Joint Commission. There's a whole list of places. So do certain entities take certain complaints? How do we know what's the best way to do that? Who to approach?
All right. So the Joint Commission is a private certification organization.
Right.
It is not a governmental agency. I've actually spoken to them on some of these issues before. So know that if you go to them, what they're going to be concerned about is, are they going to recertify a particular facility, as opposed to looking at the civil rights complaint. The Department of Justice, along with the U.S. Attorney's offices, enforces the Americans with Disabilities Act. HHS enforces the ADA, or parts of it, as well as the Rehabilitation Act. And it's hard to say exactly what the best place to go is between those two agencies. The Department of Justice gets tens of thousands of complaints and does not open, all of them. I don't know about HHS Office of Civil Rights and how many complaints they get and what percent that they open. But violations in this space is very, unfortunately, very common. And I don't know that I have an answer with a lot of, good scientific, here's the best place to go. And sometimes it's trying to, trial and error, figuring out what agency, has the space in that moment to pursue a particular issue.
Okay, okay, here we go. Someone is saying they didn't hear that it's a law now that a deaf or hard of hearing patient can be accompanied by a friend or relative in the ER.
So this has to do with the regulation that relates to companions. And that companion, is entitled to get auxiliary aids and services. The issue of a person who is hard of hearing or deaf, being the patient, having a support person, a designated support person, is a slightly different issue. That that was coming up during the pandemic with regard to people who had different kinds of disabilities. And I don't know quite how that would play out in this point in time with people who are hard of hearing or deaf.
Okay. There's a couple of interesting comments that were made by Sveta in the chat. And one thing that I think is fascinating, because people with hearing loss talk about the fact that when we don't sign, most of us, and we request CART, like Lauren Schechter is doing for us this evening, and we explain what CART is and why we need it. And more often than not, I do, and I have heard other people get sign language interpreters because the orientation seems to be towards the deaf signing community. And I always say kudos to that community because they have been better advocates and I think more outspoken than we have been, and we need to follow their lead. But in any event, Sveta is saying, for example, when she is in a telehealth appointment, she can read the captions, but she does not voice because her voice isn't completely clear. So she needs to have the option to type on telehealth. Do you know if that's available right now? Maybe somebody on the chat will know. Anyone know about that? Okay, I'm not seeing anything. All right, well, Sveta, I think we should maybe have a chat on that. So you can email about that. I would like to know a little more about that. Oh, but what Sveta was also saying was, I'm sorry, that many of the people in the deaf community don't sign. And they, in her community as well, they prefer captioning or something else, but people automatically assume that they need a sign language interpreter as well. So it's a huge issue, and this is very frustrating. And it's why we need to have patience and just realize that it's not, as Peggy said, a lack of interest or caring on the part of a provider, but they just don't know and they just don't understand. And unfortunately, they're often being left alone without an administration behind them that will make sure they have the aids and services and know how to use them and the tools that they need. So I think it's, the two communities, the hearing loss community and the deaf signing community have different needs, but we also experience some of the exact same problems. So that is why the quote that I read from Peggy, we need to ask specifically for what we need and keep doing it again and again and explain why we need it and what our experience is. So hopefully it will happen. Okay, now let me go back to this chat.
I was just going to say on that, Tony, one thing that I often tell people when I do presentations to healthcare providers is that one size doesn't fit all. and that's a myth in the ADA area.
Okay. That is very true. Okay, there's so many. I'm trying to just weed through them. This is about someone has just included that I know caption does give the option to transcribe both sides of a conversation. Here's one, what criteria does the Department of Justice employ in choosing whether to prioritize a case out of the thousands it receives? That's a great question. Steve?
So I can't speak because I don't do the intake for the entire department. I will say that when I get something in my office coming from the Eastern District of Virginia, if it has a lot of good details in it, it can be very helpful. And if a person has put together something like a chronology of what's happened, you know, that sort of thing. But I don't know that there's sort of a scientific way that even the department would, you know, say that it goes through things. And sometimes there are things that are just new issues that need to be tackled. Frankly, during COVID, there were some websites that were not accessible for making appointments for vaccines. And that was a really high priority in our society, was to make sure that people had access. So I noticed that they were settling several cases with large, like Kroger's and some other large pharmacy providers, ended up with settlement agreements. So just to give you some examples, and if you take a look on ada.gov, you can see examples of some of the cases.
Okay. See, so if someone is unable to use a telephone or a caption telephone, and they want to, you know, tell the for your scheduling appointments, and even if you tell them, you know, you have to text me or email, a lot of them will refuse to do that. But even if they say that they will email you, they invariably call you. And it just, again, adds on a lot of layers of frustration. So do they have to, say, through a patient portal or an online website, are they mandated to schedule an appointment with you that way?
So I don't know. I would have to take a look at all the facts of a particular situation to see what was, you know, happening in that situation. But they do need to have effective communication, and that's really important to understand. And I'll give you an example. It's a different communication disability, but the department filed a brief in a case involving a diagnostic company where you go to get blood tests, and they had a kiosk for check-in, and it was not accessible to people who are blind. And there wasn't an alternative way to check in other than through that kiosk. And the department explained in that brief that that's problematic under the ADA. And this is one of the things about a lot of high-tech sort of things, is they're a double-edged sword. Sometimes they can make things a lot more accessible, but sometimes they can make things a lot less accessible as well.
Okay. People are mentioning the fact that in their telehealth appointments, or even in hospitals, I know that this has been an issue with the deaf community, that sometimes if you're doing remote captioning or a video relay, that it's not as accurate. And that sometimes live captioning or live sign language interpretation is much more accurate. And we're talking about medical situations, so that is most important. So would that be considered, you know, there's the issue of you need to have effective communication, but they are offering you a solution to that. So if someone is giving someone who signs VRI, and they are giving me a remote card person and it's just not as accurate, do we have the right to get live signing and live card as opposed to remote?
So I'm going to change the wording of it a little to be in-person signing or in-person because that's, I think, a little more precise. And the issue with VRI not being accurate, the ADA explains that in order for a interpreter to be qualified, they have to interpret accurately, right? And I have to go back and look and see how captioning is discussed. But if it's not effective, that is really going to be a test. It's going to be problematic. So if things are getting garbled because the person is not on site, yes, that could potentially give rise to an ADA violation. So it is important to understand that. The other thing that happens, I'll just say this happens in nursing facilities, there'll be a meeting, you know, with 9 or 10 people. It'll be a care planning meeting that takes place periodically. And if the captioner is not on site, it may be very confusing for them to try to caption who's saying what. And if people are interrupting each other, it's harder to explain, hey, you know, I need you to speak one at a time. So there's a lot of times where people not being on site can be problematic when it comes to offering auxiliary aids and services, just as a practical matter.
Okay, excellent. I just lost another really good question. I'm trying to remember. Hold on, please, just one second. I can't find it. My apologies. Okay, I'm just checking the time. Okay, Catherine is telling us we could go for a few more minutes. I'm going to ask a favor. If you have posted a question and we have not answered it, if it's possible, can you repost it now in as concise a way possible? Because I'm scrolling up and down this huge thing, and you're really asking great questions, and I know I'm missing some of them. So if it's possible, can you please do that? Meanwhile, I'm still scrolling. Sorry, give me a moment. Okay. I'm waiting to see if any more questions come up. I just got a question saying, they're wondering what can be done to bring the judicial system. Oh, okay, I understand this. Okay, they're asking that because there are so many problems with the court system and getting access for hearings and stuff like that. So it's off topic, but the person is wondering if things are being done to enhance that. So maybe you just know, Steve, if anything is in the works at this point that we can reference elsewhere.
I speak to the court system here in Virginia about ensuring effective communication because that is legally required in the court system. People are entitled to be on juries. People are entitled to know what is going on in a courtroom. Now, that's state and local courts. The federal courts are covered by a different set of rules. It's not the ADA, but it is very important. And here in Virginia, the court system itself has an ADA coordinator that's part of the Virginia Supreme Court. And I know that she's done a lot of work. And I'm actually going to be speaking for them next month to court stakeholders about what they're required to do. And it's a very important thing that Congress, when it passed the ADA, recognized that getting access to courts was a really important part of what they were trying to accomplish.
Okay. A good question. This is something I have been really interested in about websites. Is it mandated that websites have to post for, say, for example, for hospitals what auxiliary aids and services are available to the patient. And I would add to that, I did a survey of websites of New York City facilities a few years ago. And also for myself, I was looking to find out which hospitals had what I needed, and I couldn't find anything. And a friend of mine said, look under deaf services. And sure enough, there it was about CART, but there was no mention of hard of hearing. At one of the major hospitals in the city, they have put everything in one place, and they call it language and communication services, which I think is really terrific. That is happening at Mount Sinai Hospital. The question is, Steve, do they have to post those kind of things? And then this is an example of how we can work with hospitals to try to get them somewhere where we can find them, but are they mandated to post?
There's a different set of rules for state and local governmental entities. They are required to post information on how they're accessible. The private entities, I don't think that there's the same requirement. Is it a helpful and good thing? Yeah, it is. And if you take a look at our settlement agreements, we often require that to be posted on websites and in other locations as well.
Okay, thank you. Someone is asking, are the hospitals mandated to actually provide the aids and services? They're referring to museums, so I guess they're talking about maybe headsets or pocket talkers, things like that.
So auxiliary aids and services, generally, yes. I know that some people may have their own thing that they bring with them. And I haven't really done the legal analysis of, how that plays out. But generally, the covered entity is required to furnish the auxiliary aids and services.
Okay. Also, I'm trying to interpret this question a bit. Which is, if you're, for example, I'm hospitalized, I'm having surgery, I'm going to be staying in the hospital for a week. I am unable to put my hearing aids in myself. Are hospital staff expected, what is the situation about them putting your hearing aids in for you if you're able to instruct them? What is the fine line there that allows them or doesn't allow them to do that?
You know what? That's a really good question. I'm not sure what the answer is. And let me let everyone know that the Department of Justice has an information line. If you go on ada.gov, and I would pose that to the information line and ask, because I'm just not sure of the answer.
Okay, I think we're going to have to finish up a bit. Again, you have those email addresses. I'm going to type in the web address for the Communication Access in Healthcare program, because that will get you in touch with us. Healthcare Access 1@gmail.com. That will get you to us if we have not answered your questions, if we've left something out. And again, this is something that every single person on this call needs to work on. It's very exciting to be here with all of you and to see this level of interest. I firmly believe we can get this done. We need to sort of make this a campaign and get the awareness out there that there are 50 million of us that struggle in medical situations. So please contact us. Again, we're looking for positive suggestions in terms of creating awareness, creating some movement, communicating with hospitals. We will go through the chat and take some notes and kind of think. People are sort of asking and suggesting that we do another webinar and things like this. So we will go through everything and digest it. This is the first time we've had in a while that we've had an interpreter and so many people on the call, and a new website came out today. So there's just been a whole bunch of stuff. So I'm sorry if it hasn't been as explicitly organized as it should have been, but there's a lot of heart and a lot of passion here from all of you. So thank you so much, Peggy, Steve, fabulous. Really, really appreciate this, and we will get this information out to you in different ways. So thanks a billion. Wishing you all a lovely night. Bye-bye.
Thank you.
Thank you.
I also want to
Thank
say,
you.
I also want to say thank you to Toni. She is way too much.
Bye.
She
Awesome.
put this together. And I hope a lot of you whose first meeting this is will come back to others. On November 19th, our program is on Oracast, which is a upcoming form of room size Bluetooth technology. And our speaker's Thomas Kaufman, who's some of us have heard speak before. He's a good speaker. So check on our website. If you have any questions that you don't have email addresses for, you can send them in through info@hearinglossnyc.org, and we will forward them to the right person. So thank you, everybody, for coming. Okay, bye.
Bye-bye. Thank you.
Thank you, everybody. This has been fabulous.